Good morning, everyone. Today we are going to discuss one of the most important resources for the MCCQE Part 1 examination, the Toronto Notes 2026. Many candidates purchase Toronto Notes but never finish it, or they read it once and forget most of what they learned. Today's presentation is not simply about reading a textbook. It is about learning how to study smarter, retain information longer, and maximize your exam performance. By the end of this lecture, you'll have a practical 90-day study strategy that you can begin using immediately. Let's begin by asking a simple question. Why do so many intelligent students struggle despite studying for months? Usually, the reasons are they read passively. They never review what they learned. They solve too few practice questions. Reading alone creates an illusion of learning. True learning occurs when you force your brain to retrieve information repeatedly. Educational research consistently demonstrates three powerful learning techniques. The first is active recall. Instead of reading, close your book and try to explain the topic from memory. Second is spaced repetition. Review important material after 1 day, 3 days, 1 week, and then at longer intervals. Third is interleaving. Rather than studying only cardiology for an entire week, mix cardiology with respiratory medicine or nephrology. This improves long-term retention and clinical reasoning. Preparation should occur in 4 phases. The first month is your foundation. Build a broad understanding of internal medicine and other core disciplines. The second phase focuses on the remaining major specialties. The third phase emphasizes surgery and emergency medicine. Finally, dedicate the last week entirely to revision, practice questions, and correcting weaknesses. Think of this as constructing as a building. Without a strong foundation, the upper floors becomes unstable. A productive study day should always include 4 components. First, read new material. Second, actively recall the important concepts. Third, complete practice questions. Finally, review every mistake you made. Remember, mistakes are your greatest teachers. Every incorrect question is one opportunity to improve before the real examination. Weekly plan. My recommendation is 6 study days every week. Reserve 1 full day for revision. Use this day to review flashcards, revisit weak topics, and complete a mock examination. This prevents forgetting and builds confidence. When reading Toronto Notes, don't highlight every sentence. Instead, focus on the learning objectives. Summarize each topic in your own words. Finally, teach the concept aloud as if you're explaining it to another medical student. If you can't teach it clearly, you truly understand it. If you can teach it clearly, you truly understand it. Internal medicine is highest yield discipline on the MCCQE. If you have limited study time, this subject deserves the largest share. Master common diseases before worrying about rare conditions. Remember, common diseases appear commonly on examinations. In cardiology, prioritize acute coronary syndrome, heart failure, arrhythmias, hypertension. For every disease, ask yourself, what is the diagnosis? What investigation comes first? What is the next best management step? In respiratory medicine, know asthma, COPD, and pneumonia thoroughly. Understand how patients present. Know when imaging is indicated. Know first-line treatment. And importantly, recognize information requiring urgent intervention. Focus on gastrointestinal bleeding, inflammatory bowel diseases, liver disorders. Always organize your thinking into presentation, diagnosis, management, complications. Nephrology often intimidates students. Simplify it. Understand acute kidney injury, chronic kidney disease, fluid management, electrolyte abnormalities. If you understand physiology, nephrology becomes much easier. In endocrinology, diabetes is the king. No diabetic emergencies, insulin therapy, screening, complications. Also review thyroid disease and adrenal disorder carefully. For neurology, emphasizes stroke, seizures, headaches. Develop a systemic approach to neurological examination and localization. Clinical reasoning is more important than memorization. Psychiatry questions are usually very practical. Know the diagnostic criteria. Assess suicide risk. Recognize psychosis. Understand first-line treatments. Always prioritize patient safety. In pediatrics, memorize developmental milestones, vaccination schedules, approach to fever, common childhood illnesses. Many questions test whether you recognize normal versus abnormal development. In obstetrics, know prenatal care and obstetric emergencies. Always remember, mother first, then fetus. Practice algorithms for labor management and postpartum complications. Surgical questions emphasizes acute decision making. Recognize acute abdomen, trauma assessment, postoperative complications. Remembers the ABC approach before focusing on definitive treatment. Emergency medicine. Emergency medicine requires rapid thinking. Recognize shock, sepsis, airway emergencies, cardiac arrest. When in doubt, stabilize the patient first. Family medicine emphasizes prevention. Know cancer screening recommendations, vaccinations, chronic disease management. Health promotion is just as important as disease treatment. Ethics questions appear straightforward, but require careful reading. Understand consent, capacity, confidentiality, professionalism. Whenever you answer an ethic question, ask yourself, what best protects the patient's autonomy while ensuring safety? One of the best ways to improve is learning algorithms. Whenever you study a disease, create a simple pathway. Patient presents. What do I suspect? What investigation comes first? What treatment comes next? Algorithms reduces confusion during the exam. Don't rush to answer. Read the last sentence first. Identify exactly what the examiner wants. Usually they ask, what is the next best step? The answer is often not the definitive treatment, but the immediate next action. Before the examination, memorize medical emergencies. Never miss sepsis, stroke, acute coronary syndrome, anaphylaxis, meningitis, pulmonary embolism. Recognizing these conditions quickly can earn valuable marks. On examination day, manage your time, don't panic, skip difficult questions initially, return later with a fresh perspective. Trust your preparation. Confidence comes from consistent practice. During the final week, review mistakes. Not everything. Use flashcards. Sleep adequately. Avoid learning completely new topics the night before. Your brain consolidates memory during sleep. Thank you. I'll finish with one important message. Success on the MCCQE is not determined by intelligence alone, it's determined by consistency. Study every day, review regularly, practice questions continuously, trust the process. Remember this formula: success equals consistency multiplied by smart study. Thank you for your attention. I'm happy to answer any questions in the comments.